Hello and welcome. My name is Chris Rowena, Lead Communications Analyst with Health Workforce Development at HCAI. We're so glad you could join us today for the Medi-Cal Behavioral Health Scholarship Program launch webinar. We're excited to share more about this important opportunity and to walk you through the details of the program. If you're joining us for the first time and wondering if this program is for you, we want to note that this program is only open to California residents who enroll in an eligible education program located in California and who accept a service obligation at an eligible practice site also located in California upon completion of their eligible education program. And we will talk about what all of that means as we go through the webinar. Here's a quick look at today's agenda. Going to go through a housekeeping and introduction, followed by some opening remarks and an overview of what HCAI does. We will go into the webinar objectives for today. Then we will give you an overview of the BH Connect initiative and how it ties in with the workforce initiative that HCAI oversees. We'll talk about the Medi-Cal Behavioral Health Scholarship Program overview, and then we will have time for questions and answers today. And we will finish up with some closing remarks. Here are those housekeeping items for you to get the most out of today's session. First off, the platform we are using is Zoom today, and you can find the controls at the toolbar at the bottom of your screen. In particular, it's important for number 2 that in that toolbar you will feature for asking questions and providing comments, and you can use that at any time during today's session, and we will capture all of your questions and comments throughout the whole thing. And then lastly, we are recording today's session, and it will be available on our website within 7 business days. We will also have the recording of last week's webinar on the same topic on our webpage very soon as well. And with that, pleasure to introduce Dr. Sharmil Shah, the Branch Chief for Behavioral Health and Policy, to get us started.
All right. Thank you, Chris. Good afternoon, everyone. Thank you for joining us today for the Medi-Cal Behavioral Health Scholarship Program launch webinar. And it is my pleasure to welcome all of you here today. The Medi-Cal Behavioral Health Scholarship Program that you're going to hear about is designed to support students pursuing careers in behavioral health. Behavioral health treatment can greatly improve the quality of life, helping individuals develop healthier coping strategies and manage life stressors more effectively. As students who are attending this webinar, we want you to feel supported as you have chosen to pursue an education in a field that is much needed. As representatives of colleges and universities, you play a vital role in connecting students with opportunities that can shape their future careers. But before we jump into the content of this webinar, I wanted to ground us a bit in the vision and mission of our department. HCAI's vision is to provide a healthier California where all receive equitable, affordable, and quality healthcare. Our mission is to expand this equitable access to quality, affordable healthcare for all Californians through resilient facilities, actionable information, and a health and behavioral health workforce that each community needs. HCAI has 5 main program areas: facilities, where we monitor the construction, renovation, and seismic safety of California's hospitals; financing, where we provide loan insurance for nonprofit healthcare facilities to develop or expand services; our workforce department, which expands and diversifies California's health workforce for underserved areas and populations; and the office in which this program is being administered. We have a data arm where we collect, manage, analyze, and report actionable information about California's healthcare landscape. And lastly, affordability. This office really helps healthcare affordability through data analysis, spending targets, and measures to advance value. Next slide, please. HCAI's health workforce approach and strategy is extremely important and enables us to expand and develop a health workforce that reflects California and addresses supply shortages and access to care. We do this by administering programs in 4 main areas: behavioral health, nursing and midwifery, primary care, and oral health. And we really work to serve medically underserved areas, serve Medi-Cal members, and reflect and to ensure that these programs reflect and respond to the needs of California's populations. And how does HCAI do this? We offer programs that provide financial support for organizations to build the workforce pipeline, to expand educational capacity, to support providers and addressing retention. And we also do this with individuals who are pursuing health or behavioral health careers. I want to today give you a glimpse of what our objectives will be for this webinar. We're going to provide a brief presentation on the program and the funding cycle, share some key dates and requirements for those of you who are applying. We're going to also offer an open forum for a Q&A session so we can address all of your questions. But before we jump into that, I want to do a quick overview of BH Connect and the Workforce Initiative. In December of 2024, the Department of Healthcare Services had received approval from the Centers for Medicare and Medicaid Services, CMS, for the transformative BH Connect initiative. And this program seeks to transform California's behavioral health delivery system by expanding access to highly effective community-based services, strengthening the behavioral health workforce, and ensuring that Medi-Cal members receive high-quality care. Slide, please. So the BH Connect Workforce Initiative supports the training, recruitment, and retention of behavioral health practitioners to provide services across the continuum of care within Medi-Cal safety net settings and serving Medi-Cal members and the uninsured. So between 2025 and 2029, in partnership with the Department of Healthcare Services, HCAI will invest up to $1.9 billion in 5 workforce programs. Recipients of this funding will need to commit to serving Medi-Cal members who are living with significant behavioral health conditions or needs for 2 to 4 years. What's notable here is that the state may carry unused workforce initiative expenditure authority from one year to the next. So after demonstration year 2, the state may redistribute up to 30% of those workforce funding across other programs. These are the 5 BH Connect Workforce Initiative programs. We have a student loan repayment program, which opened in July of last year. We have a scholarship program, which is what we're talking about today. We have a recruitment and retention program, which will open soon, and a community-based provider training program that will also open soon, and then our behavioral health residency fellowship training program, which opened in July of last year. So now I'm going to turn it over to Samantha Sadler, our Behavioral Health Policy Analyst, who will get us started. Thank you so much.
Hello, good afternoon, everyone. My name's Samantha Sadler. I am a Behavioral Health Policy Analyst here at HCAI. I'll be walking you through the Medi-Cal Behavioral Health Scholarship Program, the MBHSP overview, highlighting eligibility, funding, and other program requirements. The goal, as briefly mentioned, was that the scholarship program is to expand the number of behavioral health professionals working in Medi-Cal safety net settings by supporting individuals who are pursuing behavioral health degrees or certifications. In other words, we are here to support students with completing their education to enter behavioral health roles where Medi-Cal members need care. For the funding, this upcoming cycle, which officially launched Monday, February 2nd, we have up to $96.9 million available. Individual awards may be as high as $240,000 in scholarship, depending on the profession. These award levels and virtually all rules are outlined in the BH Connect and established in the special terms and conditions, which is part of our agreement with the federal government to administer the workforce programs. Please note that if a profession delivers Medi-Cal covered behavioral health services in Medi-Cal safety net settings, you may be considered under program rules. We'll go over this in more details in the next slide. Eligible professions. So applicants who are pursuing education to become one of the eligible professions listed here can receive awards through the MBHSP. The program covers a broad set of behavioral health roles, which include alcohol and other drug counselors, certified peer support specialists, certified wellness coaches, community health workers, known as promotores or representatives, licensed clinical social workers, licensed clinical psychologists, licensed marriage and family therapists, licensed professional clinical counselors, licensed psychiatric technicians, licensed vocational nurses, nurse practitioners, occupational therapists, physician assistants, and registered nurses. I'd like to emphasize that our agreement with the federal partners is very clear that we can only fund degrees or training programs that are behavioral health specific. That means that the curriculum must focus on behavioral health and lead directly to licensure or certification as a Medi-Cal behavioral health practitioners. Like to highlight that students that are currently in MSW, the Master's Social Work students, are eligible for this program as long as they're working towards becoming a licensed clinical social worker, which includes associate clinical social workers. Next slide, please. Perfect. All right, so this slide shows that the maximum award tiers and the corresponding service obligations. The first tier, we have the nurse practitioners and the physician assistants. Those are eligible for up to $240,000 and carry a 4-year obligation. The second tier, we have the set of licensed and aligned health professionals. Those are eligible for up to $180,000 with a 4-year service obligation. The final tier, you have AOD, counselors, peer support specialists, wellness coaches, and community health workers that has a max award of $120,000. However, their service obligation length scales with that award amount. So just holding here on this slide, breaking this down a little bit more to focus on the license and the prescribing behavioral health practitioners. Licensed and prescribing behavioral health practitioners, as well as licensed associate level pre-licensure practitioners, the service obligation is always 4 years, no matter the scholarship. For non-licensed and non-prescribing practitioners, the obligation depends on how much funding they receive. So awards of $120,000 or more require 4-year services. Any award between any award between $10,000 to $20,000 require a 3-year commitment, and then any award less than $10,000 require 2 years service obligation. Just noting here that the length of service obligation is due to the nature of the federal agreement. Next slide, please. So we will cover the eligibility requirements and address additional requirements in more detail in the following deck. By September 30th, 2026, you'll start an eligible education program that leads to licensure or certification. You would be responsible to submit a free application for federal student aid, known as FAFSA, and a Cal Grant application to provide the resulting financial aid award letter in the application portal. The scholarship verification form will be sent annually from HCAI to verify that the applicants are actually part of the declared program. Students will verify academic status with their registration office, and the latest that you can complete your education program is June 30th of 2029. You have to maintain an active registration, licensure, or certification in an eligible profession for the duration of the grantee's full-time service requirement and serve a full-time service obligation providing direct care and a medical safety net settings, which we will discuss next. So all service obligations must be completed in a Medi-Cal safety net setting, and these include federally qualified health centers, community mental health centers, as defined and certified by the California Department of Public Health, rural health clinics, settings with the following payer mix. So the programs recognize hospitals and other behavioral health settings that meet specific payer mix thresholds, So for example, hospitals with a 40% or higher Medicaid and or uninsured payer mix, rural hospitals with 30% threshold, and other behavioral health settings with 40% or higher Medicaid and or uninsured populations. Other behavioral, sorry, just to go back on that last slide. Thank you. So other behavioral settings is a broad category that covers a wide range of sites for the purpose, but for the purpose of today's meeting. Oh, I'm sorry. Next slide. I apologize. I'm on the wrong slide. Thank you. So for the other behavioral health settings, so there is a long list here, and I won't be reading those off. But I just want to emphasize that all of these settings must meet the Medi-Cal payer mix requirement that was previously mentioned, and all of these examples are included in the grant guide for your reference, which is listed on our website. Next slide, please. Alrighty, so wherever employed, service requirement is a minimum of 32 hours per week providing direct care, or 30 hours per week of direct care in a school-based behavioral health setting. So you can work at one or multiple organization if it meets service obligation requirement. Keep in mind, full-time service must begin December 31st of 2029 or 6 months after program completion, whichever comes sooner. Next slide, please. Alrighty, so for the funding categories, scholarship funds are restricted to education-related costs. Specifically, funding can only be used for tuition and mandatory fees for like textbooks and supplies required for your enrolled program. Unfortunately, funding cannot be used for living expenses, including on or off campus housing, nor childcare, transportation, or other costs that are related directly to the anything that's not related to the coursework. Just wanting to note here that scholarship payments are made directly to education institutions, as the funds cannot be provided to individual participants per the special terms and conditions that I've mentioned earlier. And with that being said, I am going to be passing it over to grants management. Thank you, everyone.
Hello, my name is Charles Faust. I'm the program officer for this program. I'm going to be going over some key dates and parts of the application process. So our key dates are the application is already opened on February 2nd at 3 p.m. The deadline to complete and submit your application is March 16th, also at 3 p.m. We anticipate sending out awards in June and starting grant agreements in August of this year. For the application, you'll have a process of pages that you have to go through. The first one is going to be an attestations page, which is going to ask you to click to agree to terms of the grant. Then you're going to select your profession that you plan on being. You're going to then go to a page that will ask you for your degree. And then you'll pick the pathway for that degree, a specific school. Then you'll have a page of listing if you have any conflicts of interest. Then you're going to select your expected graduation date for the program. The next page will be your FAFSA and Cal Grant upload. For this page, we're looking for the 2627 FAFSA. You're then going to go to a tuition and budget page that you'll be asked to submit what the publicly listed tuition is for the program, and then also provide a URL link to the page that shows the publicly listed tuition for the program. Then you'll have to, next page will be the budget and obligation details. And then we'll ask some additional questions. It'll be more about your background information and questions about where you're going to school. Then you'll have a page that'll have you confirm your profile information. And then finally a page that'll be a confirmation and submission. What you will need to apply. You will need to have already applied for the FAFSA before applying for this scholarship, because you will need to prove that you have applied for the FAFSA. We'll need a screenshot of that. Then we'll need a screenshot displaying your publicly listed tuition for academic year 25 or 26. We realize that some colleges are already displaying the 26-27 academic year tuition, so we'll also accept that. Whatever is publicly listed on the college page is fine. And then if you have a conflict of interest, we'll need that uploaded as well. Payments will be made directly to the grantee's educational institution, not to the grantee. Multiple payments may be issued between August 2026 to May 2029. The grantee must notify HCAI immediately of any changes or delay in completing their education program or service obligation. HCAI expects the grantee will begin performance of the responsibilities on the start date in the grant agreement. HCAI cannot provide tax advice to any grantee. HCAI are not tax professionals, and tax consequences may vary depending on the grantee. For this reason, grantees may seek professional tax advice. Should seek professional tax advice. Breach policies. HCAI will recoup all payments made on the behalf of the grantee if the grantee fails to complete their education or perform their service obligation. HCAI acknowledges that the service commitment associated with this program may be extensive, up to 4 years. Applicants are therefore encouraged to carefully evaluate their personal and professional goals prior to entering into a grant agreement. In the event of a breach of the agreement, the grantee will owe the entirety of their award amount back to HCAI. Except in very limited circumstances, HCAI is unable to waive a service obligation after payment to your educational institution has been issued. Please refer to pages 21 and 22 of the grant guide for the waiver policy. We are now going to go over the evaluation scoring procedures. Application evaluation criteria. Scoring criteria includes consideration of the following elements. Select languages known other than English, which is worth 10 points. Prior participation in publicly funded grant programs. This is going to be worth 15 points. Prior experience working in a Medi-Cal safety net setting. This is going to be up to 10 points. HCAI's Behavioral Health Scholarship Program or Wellness Coach Scholarship Program recipient. This is going to be worth 3 points. Educational institution type. This is going to be whether you are attending a public or private educational institution, and this is worth up to 3 points. And then your degree type, whether your degree is a graduate degree or an undergraduate degree, and this will be worth up to 20 points. We have resources that'll help you when you're applying. The main one will be the grant guide. This link at the top, I believe, is to apply for the program. We have the grant guide, we have the informational flyer, and this webinar will also be uploaded. And last week's webinar will be uploaded as well. There might be more Q&A answers in that will help you. Thank you. I'm going to pass it back to Chris to initiate the question and answers.
All right, thank you, Charles. As you can see, our team has already put a lot of thought and effort into this program, and we're thrilled that you're here to learn more today. As we transition into our Q&A session, remind you to please use that Q&A feature located in the Zoom toolbar at the bottom of your screen. Many of you have already been doing that, and we're tracking your questions already. You can continue to submit those questions at any time, and we'll be able to capture all of the questions that are submitted. We do our best to answer as many questions as possible in the time that we have today, but we may not be able to get to everyone. We do ask if you have questions about your personal situation or whether a degree program qualifies for this scholarship. Please email us at mbhsp@hci.ca.gov, and you can see that email address on the screen right now. We're asking these questions be sent directly instead of through the webinar Q&A because there are so many attendees and degree programs out there, often with similar or different names, and it's hard to give accurate answers on the spot. So by emailing us, that ensures that you get a clear, accurate response on whether that specific degree program is eligible or not. And again, as I mentioned at the beginning of this webinar, I do want to emphasize that this program is only open to California residents who enroll in an eligible education program located in California and who accept a service obligation at an eligible practice site also located in California upon completion of their eligible degree program. So with that, I'd like to welcome our Q&A panel, and we're going to jump in. We've already got lots of questions in the queue, and so let's jump on in. First question is, does CEU training educators count? Like if I want in DBT, IFS, or other similar programs, CBT, do those count?
Chris, I think this is one of those questions that we're going to ask Catherine to email to the email address on the screen.
Sorry about that.
Or actually, wait, continuing education units.
I was going to say, yeah, that's a slightly different
Yeah,
a degree program. So I think that's where.
yeah, sure. Andres, do you want to speak to that now, or do we want that sent to the inbox?
Yeah, I mean, I could just clarify that the scholarship program supports enrollment in qualifying degree programs, not necessarily standalone continuing education or certification training. But if you have specific questions about a program, yeah, please feel free to email the scholarship inbox for further guidance.
All right, thank you. Got an application question. In applying, how do I submit my school of choice to show accreditation as there are limited choice of schools on the application?
Let's have Charles answer that one.
We're going to ask you to not submit your application yet and to email the MBHSP inbox with your school that you're wanting to apply to.
All right, so Megan, go ahead and email us with the details of your situation, and team will help you figure out how to apply from there. All right. What is the website? Let's make sure we get that link posted. You can always find everything at hci.ca.gov and search for the program name, and that will take you directly to it. But we will find a way to get that posted. It is in the slide deck as well. Do we want to go back to that resource page? The slide previous to this, I think, had the actual web page on it. All right. I think we can just type an answer in the reply as well on that. So if the team can do that, that would be helpful. Make sure we get that information out. Okay. Two questions from Joey. Let's see. We've got the first one. I am a four-year doctoral student in clinical psychology and have two questions. Does the scholarship reimburse tuition I paid in the past? And two, how much time do we have to decide whether to accept the scholarship or not?
Yeah, I'll turn this over to Charles.
Sorry, I couldn't actually hear what you were saying for part of that. It cut out. Andres or Nathan, can you answer this?
Yeah, so the scholarship does not reimburse tuition paid in the past. This is for upcoming enrollment years. How much time do we have to decide whether to accept the scholarship or not? So upon notification of award, we'll give you a stronger, like a firmer timeline about how long you have to give this decision back that is dependent on, when we make the award notifications. Typically, it will take us after notification a week or two to send out grant agreements. And once grant agreements go out, we require you respond within 2 weeks. If you have not responded within 2 weeks with a signature and confirmation you're accepting the award, there is a possibility we will have to revoke the offer and move those funds to another qualified applicant.
All right, thank you, Nathan. Next question. If I will be studying at two educational institutions at the same time, will I need separate applications and scholarships for each one?
Interesting. I think we'll start with Charles on this.
I'm going to pass this off on to Andres.
Sure.
So you may only be eligible to apply to one program, so you'd have to submit one application, and unfortunately receive one award to your qualifying degree program.
All right. Uh, Again, want to remind everybody for questions regarding specific programs, please email us at the email address on the page, and we'll be able to help you figure that out. All right, next question is what expenses are eligible for the 180,000 funding? Do all costs of attendance, including room and board costs, also qualify like they did under the previous two grants? Thank you.
Thanks. I'll pass this to Andre.
So the scholarship only covers tuition, any required fees, and can include book and supplies if indicated. It does not cover room and board or any other type of living expense.
All right, thank you, Andres. Let's see. Even if I don't plan to pursue my PhD until fall, can I still apply for the scholarship now?
Andres?
Yes, you may apply as long as you begin your academic program by September 30th, 2026, and meet all other eligibility requirements.
All right. Just a reminder on things outside of California. All three conditions must be in California. Uh, so just a reminder on that. The application for Medi-Cal Behavioral Health Scholarship Program asks for one school for which the applicant is applying. Okay, what answer should a student applying for a new graduate program enter if the student is applying for multiple graduate programs?
I'm going to try to start this one with Charles.
Well, you can only apply for one. So pick the one that you're most likely going to attend and apply using that one.
So I think the issue for these folks is I don't think they've been accepted yet into programs, and so I think there's questions of I'm applying for 5 programs, hoping to get into one. Which one do I put in?
I'll step in here. Yeah, do apply for the one that you feel perhaps most confident in or most likely to, accept if offered. Where you feel most confident in ending up. We do anticipate there will be a step before or as we make award offers to confirm your enrollment. And if it turns out you ended up enrolled in a different eligible program from what was on your application, that is not necessarily a blocker in accepting an award should we offer you one.
All right. Thank you, Nathan. Next question. After applications for the scholarship are submitted, received, and confirmed to have been completed properly, how long does it take for applicants to be, screen moved on me, notified if they've been accepted into the program and subsequently receive an offer letter?
Charles?
Our anticipated award notice date is in June, not a particular date, but you'll be notified that you're awarded if you're selected for the grant in June.
All right, thank you. Okay, this next one. If you receive the loan repayment program grants, can you also apply for the scholarship to pursue your PhD?
Charles?
I'm going to pass this one to Nathan.
That's fair. Unfortunately, the answer is no. The loan repayment grant does come with a service obligation. The scholarship award comes with a service obligation. We do not allow competing or conflicting service obligations.
All right, thank you. Again, reminder, if you're asking for specific program eligibility, like does I'm applying to this particular program. Does it apply? Please email us with the details and we will get back to you. Um, Question about does this program include school psychologists?
Andres?
Yeah, so eligibility for school psychologist is going to depend on the specific degree pathway. You can confirm whether your program qualifies by selecting your intended profession and degree in the application to see if your specific program appears on the eligible list.
And then Andres, do we maybe want to flash for the eligible professions slide here? As I think this is a question about, is that an eligible profession to be moving toward?
Uh, do we want to go back to that slide? So, school psychologists are not an eligible profession per se, but again, it depends on the eligibility of the program or the specific pathway that you're taking. Um, it could be a route through a school psychologist program, but yeah, if you have specific questions about whether your program's eligible, I would suggest you reach out to the scholarship inbox.
And if I can step in, I do want to call out that upon completion of your education, there is an expectation of a service obligation in a Medi-Cal safety net setting. Um, so a school psychologist, may not end up at a site that is eligible for that service obligation. And if that's an ultimate goal of yours, you may end up spending some time in between fulfilling the service obligation.
And also adding on to that, Nathan, that you'll need to accept a job as one of these professions listed on this slide. Okay.
All right. Great questions so far. Next one, how can I ensure that jobs I apply to would qualify as a Medi-Cal safety net setting?
Pass this to Charles.
There is no real good way for us to verify that prior to you and your employer submitting your employment verification. You can do some research into the job that you're looking to apply to and find out if they meet the criteria for a Medi-Cal safety net setting. And if they are one of the listed facility types, like a FQHC, a CMHC, an RHC, or hospitals that have a really high payer mix, but we can't verify prior to hearing from your employer that it is a eligible practice site. But while you're looking for practice sites, you can email us and let us know, and we can help you in some ways and let you know if the site doesn't look like it's going to be eligible.
All right, thank you, Charles. Let's see, next question. Can you be a part-time student or does it require to be full-time?
Andres?
Yeah, applicants need to be enrolled full-time in an eligible program. Full-time enrollment is considered a minimum of 12 units per semester or quarter.
All right, thank you, Andres. Let's see. Next question. Um, so this question, trying to find one that we haven't answered yet. So make sure that we're using our time well today. Education settings that offer behavioral health services under the fee schedule qualify for the service obligation.
I'm going to pass this to Charles as a starting place.
I'm going to pass it to Andres.
Perfect.
Yeah, if you have specific questions about the behavioral health setting post-graduation, I would suggest reaching out to the scholarship inbox just to more accurately answer your question about the specific setting.
Okay. Let's go ahead and ask this one just because I think this situation is unique enough. that I'm not sure exactly how it applies. And so I'm not a resident of California, but I'm currently attending undergrad at UCLA. Would I still qualify, or must I have California residency even if I plan to work in California afterwards? So it looks like all intentions are to be in California, but we have the question of residency.
Do you want to take this one, Charles?
You do not, you need to work. Your service obligation needs to take place in California. You do not need to be from California to be able to apply for this scholarship. You will need to reside in California, or at least have your practice site be in California while doing your service obligation while going to school.
All right, thank you. And again, reminder on the specific program details of does my program qualify, please email us. Okay, clarification on dates. Just to clarify, we have to be part of an education program once September 26th rolls around. If we were to graduate before that date, would we not be eligible for this scholarship?
Andres?
Yes, that's correct. And you would need to be enrolled for a program for the fall 2026 term. So if it's before then, unfortunately, would not qualify.
Okay. All right, so this next one, what does it mean to complete the program by 2029? In case of licensed psychologists, the program is 5 to 6 years in length. So if they start in 2026, they will be done no earlier than 2031.
Andres?
Yeah, unfortunately, due to the tight timelines from the federal agreement that we have, that state has with CMS, we do require all applicants to start their program to complete their program, sorry, by June 2029, just to ensure that there's enough time to complete the service obligation. So unfortunately, if your program extends beyond that date, you would not qualify, as you would not have sufficient time to complete a service obligation.
All right, thank you. Let's see. Can academic programs be online, such as an online master's?
Andres?
Yes, academic programs could be online as long as there's a physical presence within the state. But yes, online programs are eligible for the scholarship program.
All right. Let's see. I started a Psych D and clinical psychology program in 2025, and I'm expected to graduate in June 2030. Does that mean I won't qualify for these scholarships because I would be graduating after 2029? We're still working on that data
Yeah.
understanding there.
Andres?
Yeah, so similar to the previous question, unfortunately, if you were to complete your program in June 2030, that would not provide you with sufficient time to complete the 4-year service obligation before December 2033. So you would not be eligible for this scholarship program.
All right. Can the funding be used to pay for an unsubsidized loan?
Charles?
The funding from this scholarship goes directly to your educational institution, so it's not going to pay off any previous loans that you have.
And just to clarify, this is a scholarship program. It's not, the award is not for loan repayment in any form, but HCAI does offer a number of loan repayment programs, including the Medi-Cal Behavioral Health State Loan Repayment Program, which you can see more information about on our website. So if you're interested in loan repayment, do keep an eye out on those programs.
Yeah, and I'm imagining in this situation they probably already have the loan and are wondering if that can pay the loan's paying for their tuition right now. But yeah, I think that's the hitch there is they go directly to the institution. All right. Let's see. I am an awardee of the previous Wellness Coach Scholarship. Does the 70K I received count towards the max disbursement for this scholarship?
I'm going to pass this one to Nathan.
Yeah, that's a good question. Andreas, you may want to step in as well, just in case I get some facet of this wrong. Um, you can reach out to us for more information about this, but effectively, if selected for a scholarship award under this program, we will be replacing your Wellness Coach Scholarship service obligation with this service obligation. And I don't believe we have any intention of offsetting your award based on how much you receive from Wellness Coach, but that point, I'll leave to Andreas to clarify.
Yep, that's correct, Nathan.
All right. Thank you for the answers and great question, Lacey. Um, let's see. All right, here we go. Do I have to apply for both FAFSA and Cal Grant? I don't think Cal Grant is an option for me.
I'm going to pass this one to Andres.
Yes, unfortunately, due to the terms of the federal agreement between the state and CMS, we do require applicants to apply and submit verification regarding their application to FAFSA and Cal Grant. That is part of the application, so we do require you to verify submission.
And Charles, do you want to add anything to that?
No, I think that's clear.
Great.
All right, next question. If the amount needed for a certification program is less than 50,000, for example, does the service obligation reduce in years?
Andres?
So it really depends on the profession selected. I think with any of the professions, however, $50,000 would automatically have you in the 4-year service obligation, so that wouldn't have any impact. There is that third tier that does have some discrepancies between required service obligations. I'd refer you back to the grant guide to confirm the profession that you're specifically applying for. But given that specific example, it would result in no reduction to your service obligation. That would immediately be a 4-year service obligation.
All right, thank you. All right, looks like it's just a little bit of information in here about the process for Cal Grant. All right, what about a situation where the tuition is not publicly listed? What can they submit instead?
Charles, are you able to answer that?
Yeah, I haven't come across an educational institution that doesn't have their tuition listed in some way on the website. You might have to dig for it, but your educational institution is going to have tuition listed in some way. It might be the cost per unit or the cost per credit or the cost per class, as opposed to, this school costs $30,000 a year. It might be very broken down, but it's going to have it somewhere on the website.
And I will add on onto that, recognizing that it can sometimes be difficult to find like a hard number for a full tuition cost or a number of for tuition fees that we cover with the scholarship compared to additional fees we don't cover. We are taking time to verify tuition information. We ask only that you provide your best effort. Do give us a link, do give us a screenshot, give us your best effort with that number, and we will take an extra step to verify that information on our end as well. If you enter tuition information that is incorrect, that is not necessarily a blocker for your eligibility for the program or consideration for an award.
All right, thank you. All right, question of do they need to be accepted by the program to be considered for the scholarship?
Pass that to Charles.
To be considered for the scholarship, you don't need to be accepted by the program to receive to receive the grant, the scholarship for the institution to get paid. You'd have to be enrolled, accepted and enrolled in the program.
All right. And is there a date that they need to be accepted by for this?
I'm going to pass this to Nathan or Andres.
September 30th, 2026.
Thank you, Nathan. Let's see here. Um, Bear with me. We've got lots of questions in here. All right, are private schools or community-based education programs that offer some of the non-prescribing occupations still eligible for funding, or are only public schools eligible?
I'll pass this to Andres.
Yeah, so both public and private institutions are eligible for the scholarship program. You'd be able to verify whether your program's eligible by starting an application and selecting your profession to confirm whether your program is one of the listed eligible programs. But again, there are no restrictions as far as public or private institutions. We accept both.
All right, thank you. Okay. If I received the behavioral health scholarship last year for 1 year and have to complete that service, would it be okay if I start my 4-year commitment for this scholarship after completing that 1 year?
I'm going to pass this to Nathan as it relates to BHSP and service obligations.
That was my question if we were talking about
Okay.
BHSP. Okay. So like with the Wellness Coach program, if you're selected for an award from this program, we will replace your previous service obligation with the service obligation from this program. Now, if you only owe a 1 year service obligation to BHSP, that is something to keep in mind, consider in whether or not you accept an award from this program, as you are looking at, depending on your situation, at least a 2 year, but most likely a 4 year service obligation.
All right, thank you. It was mentioned that the payment would be made directly to the school institution. Would it also be possible to directly pay a loan through FAFSA that was taken out to pay tuition? I think this was similar to the question that we had answered earlier.
Yeah, I'll pass it to Charles.
So no, this program only pays the educational institution directly. You would be looking to apply in the future maybe for our Medi-Cal behavioral health student loan repayment program.
Okay. And question of where is the application at? And you will find in the Q&A, you can see the web page that is listed there, but we can post that application link as well. All right, let's see. I think we've answered those questions before. Yeah, a few different questions about BHSP I'm seeing in here.
I'm happy to recap that if we do have multiple questions about it. So if you are a current awardee for the Wellness Coach or BHSP programs, I said program twice there, and are selected for an award from this program, your existing service obligation will be replaced by the service obligation for this program. This may result in a longer service obligation than than you currently have. And so do please keep that in mind and take that into consideration in making your decisions about what you apply for and what awards you accept. That said, there is no harm in applying for this program, and if selected for an award, simply choosing to decline it because at that point you decided is not the right fit for you.
All right. Thank you, Nathan. I have a question about will this program be offered next year as well? Will there be additional cycles coming?
Yes, I can answer that, Chris. We anticipate to offer a cycle in 2027 around the same time and another cycle in 2028. So 3 cycles total. The important thing to know about that is that this first cycle, we can offer up to 3 years of academic funding. The second cycle, we can only offer up to 2 years of academic funding. And the last cycle, we can only offer up to 1 year of academic funding. And that is because of the timelines that we have to adhere to per our agreement with CMS. with the federal government.
All right, thank you, Lindsay.
Mhm.
I do have a question here from somebody that has already sent an email and just I think wants a reassurance on time it takes to get a reply back on emails.
Yeah, we could pass that to Charles. I think this was somebody inquiring about their particular school.
Yes.
We try to get back within 7 days or 5 business days. We've had a large load and inquiries, especially about specific programs, so it's taking us a little longer, but we will get back to you. Sorry
I
about
will
having to wait a little bit.
I will chime in to say that inquiries about specific programs in particular are taking us a little bit longer. So we appreciate your patience and promise we will get back to you as soon as we are able.
All right, thank you. Next one is the grant or the scholarship. Is it paid before or after graduation? When is the money actually transferred?
Charles, would you like to answer this or I can support?
Yeah, the educational institutions, there's a little bit of variability in how they're getting paid, but they will get paid for the academic year that you are attending. So it won't be after you graduate, it'll be while you are attending the program.
All right, very good, thank you. Next question, how do the points work for the type of school or institution we select? Or is it higher points for public or private colleges?
Can I pass this to Charles?
The public universities get more points than the private universities in the scoring scenario. All of this is in the grant guide. I saw one question earlier asking, and I'll just answer it here because it'll be easy. If Pell Grants counted as a publicly funded grant, and they do. And the list of all those grants and publicly funded programs is on page 14 of the grant guide.
All right, thank you. We are running out of time, and so I'm going to be scanning through to make sure that we get questions that have not been answered yet. I think one indicates maybe some confusion on the service agreement, the nature of the service agreement. Does the service agreement have health and dental insurance?
I will pass it to Charles.
Sorry, what was the Nathan or
We'll
Andres,
pass.
if you want to take this?
Yeah, Nathan.
Yeah, I do apologize. So the service obligation associated with this award is just that. It's an obligation to serve in a Medi-Cal safety netting for 2 to 4 years. It does not come with any form of like medical or dental insurance. That would be something that you would likely get through your employer. But that's what the service obligation is. It's just an agreement between you and HCAI that you will, spend 2 to 4 years serving patients in a Medi-Cal safety net setting.
All right. And two questions that we're going to wrap up with here today before we run out of time. Both of them applying also to what happens when you're in that service obligation time frame. The first one is, are you allowed to switch place of employment as long as it falls under the safety net requirements? And the second one is, are we guaranteed a job as a part of this, or are there places that will ensure that that money is used?
Nathan?
Yeah, so man, I just lost my train of thought. Chris, can you give it to me one more time? I apologize.
Uh, yeah, are they able to switch jobs as
Yes.
long as it meets the requirements? And is there a guarantee of employment that
Thank you.
comes with the service obligation?
That's the one I lost my train of thought on. So
Sure.
we do not offer employment placement assistance. There is unfortunately no guarantee of employment should you accept this award. You do have some time after you graduate. I believe it's roughly 6 months, or should be in most cases, to find eligible employment and then begin your service obligation. But we do not offer employment placement assistance beyond helping as best we can to confirm potential eligibility of a site where you might accept employment. While you have your service obligation, yes, you can change sites from one eligible site to another. We again will help you kind of guide you in determining eligibility of a potential site, although final eligibility is determined using some information we gather from that site. And we do want to caution, sometimes people take time away from work. We do want to caution that there is a fairly strict timeline and completion of your service obligation here. So try not to take too much time away from work in between jobs if you start changing sites.
Okay. There are a couple other pretty important questions I want to get answered. One is about what is a conflict of interest?
Charles,
For
Nathan.
for the purposes of this program, if you end up working for a state agency, we do need to collect a conflict of interest letter that demonstrates that your employment with the state is not a factor in our award decision and will not be a factor in your ability to complete your service obligation.
Then this will be the last one. Uh, could you clarify what counts towards the 32 direct hours? Is that exclusively to face-to-face client contact, or does it also include indirect hours such as supervision, documentation, and team meetings?
I know the answer to this is in the grant guide, but for a verbal answer, we'll pass this to Andres.
Yeah, I'd refer you back to the grant guide just to get it's a pretty long list of what we define as direct client care, but it typically includes behavioral health services such as prevention, early intervention, assessment, treatment, and counseling. Again, there's a pretty comprehensive list on the grant guide, so I'd refer you back to that, but that's what we consider direct client care to be counted as the full-time service.
Page 9 of the grant guide specifically. Andreas is right. It's a long list. I do encourage you check out the grant guide and take a look.
All right. Thank you, both of you, and thank you to all of our panelists today for your help in answering these questions. Thank you for all of our participants for your thoughtful questions and active participation as well. We do ask if we didn't get to your question today, we did try to answer as many of them as we could. But again, please just reach out to us at mbhsp@hci.ca.gov. Understanding that we do have a lot of people applying for this program, so we will get through everything we can as fast as we can. I am now going to hand it back to Dr. Shaw for some closing thoughts.
Thank you, Chris. Just want to thank all of our policy, research, operations, and grants team, and again to all of you for spending your valuable time with us today. We really hope that you benefited from this webinar and learned more about how to take advantage of this very important opportunity. So on behalf of our team, myself, and HCAI executive leadership, we thank you. And I will now turn it back over to Chris to wrap us up. Thank you again.
All right. Thank you, Dr. Shaw. Well, thank you everyone again for joining us today to learn about the MBH Scholarship Program. And we are proud to offer this as part of our BH Connect Workforce Initiative, but also as a part of our broader efforts to strengthen California's behavioral health workforce. If you're not familiar with all of the work that HCAI does, we would love for you to go check out our website and see all of the resources that we offer. We would also encourage you to follow us on your favorite social media channel, and feel free to tag us with any great work you're doing that helps make California a healthier place. One of the ways that you can stay in touch with us and know what's coming up is for you to subscribe to our monthly workforce newsletter. You can do so by going to the email address at the top of the web address, excuse me, at the top of the screen here, hci.ca.gov, with that mailing list there, and go ahead and select any option under health workforce, and you will be added to our monthly news list, and we will tell you what's going on and what's coming up. We do have a BH Connect helpline that you can call at any time, 916-326-3899. And again, you can email us at mbhsp@hci.ca.gov. As a reminder, the program closes on March 16th at 2026 at 3 p.m. So don't wait to get your application submitted. And with that, thank you for attending. We appreciate your time and interest, and we hope that you have a wonderful day. This does conclude today's webinar.